Thomas Cayne, Twilight of Death. When we die and subsequently stop breathing, our brain and nerve cells die within a few minutes due to the lack of oxygen. Once a person dies, though, his or her body enters the so-called twilight of death. After the brain and nerve cells, the heart, liver, kidneys, and pancreas come to die in about an hour, and then the skin, tendons, heart valves, and cornea are next. But they will last about a day. The white blood cells even keep going for almost 3 days before finally shutting down. In some sense, some parts of your body live an itsy-bitsy tad of a bit longer than yourself as a whole. But that's not the scary thing about the twilight of death. In a matter of days, sometimes even hours, after the individual is declared dead, gene transcription, the first step of gene expression, where a segment of DNA is copied into RNA, starts to take place, and the consequences are beyond horrible. For years, researchers have observed that recipients of donor organs, such as livers, often exhibit increased risk of cancer following a transplant. And nowadays, some researchers really think that there could be a deep link between twilight of death gene transcription and this increased cancer risk. In a blind panic, some cells try to survive the death of their host and attempt to repair themselves in a last attempt to remain in life mode. And it is in that state of mind that the early seeds of cells going berserk are born, before an actual cancer surfaces much later in the recipient of the donor organ. As if the demise of the organ donor has sublimated into the cancer of the recipient as the last echo of its previous owner, willing to revive once again and ready to grow.